Hi, thanks for watching this presentation on using free publicity to generate local Medicare insurance leads and referrals. It's an incredibly powerful tool. This is going to provide you with the hands-on tools and steps that you need to do to easily be successful. And I promise you, after watching this, you can be. My name is Jesse Slome. I'm the director of the American Association for Medicare Supplement Insurance. We're a trade organization, but way before I started heading up insurance trade associations, I was a public relations executive for major New York City agencies that handled clients like Aetna and Citibank. I was director of marketing for Transamerica. I won a number of public relations top industry awards. The one that probably has made me most famous was for the national introduction of the Cabbage Patch Kids dolls. I am an incredible believer in the power of publicity, of public relations, to generate meaningful, actual results that can put money into your pockets. And that's what we're going to talk about. I have developed a Medicare Insurance Agents Publicity Toolkit, we'll explain a little bit more at the end, that actually is the tools that you'll need to easily see your name and your business's name in local newspapers and print publications. And there are thousands of them around the country. Also, to become an expert, the one that's interviewed on local radio shows and even appear on television. But this broadcast, this segment is going to focus on print media, local newspapers in particular, because that's the easiest and probably the best place for your name and your business's name to appear. So let's talk and take a minute to talk about really what is positive publicity. Why should this be something that you want to do for your business? Well, the real benefit of being publicized is that you get to be seen as the local Medicare insurance expert, the professional that media turn to. When we all read articles in our local newspapers, we look at the people who are quoted, who are referenced as, wow, those are local experts that we assume the local editor actually sought out and turned to as the person in the community who can give the best information and the best advice. So when we see that, so will other consumers. They will see the persons whose name is in the publication as the person they want to connect with. And the beauty of publicity is this is something that you can do yourself very easily with a little bit of effort, and I'm going to go through the steps. And the media actually wants you. The media exists to provide beneficial, helpful information for consumers. They want to talk to you. They want that beneficial information, and that's what we're going to talk about giving them. And probably the best thing is there's absolutely no cost. Advertising costs money. When you get your little local newspaper or your daily newspaper, you know that there are ads in there. Those cost anything from a few $100s to many thousands of dollars. Publicity is free. Really, it's just going to take some time. Your greatest opportunity is print media, local print publications, and we're going to only focus on local, the newspapers that basically you read, and so do your neighbors. There are 1,300 daily newspapers across the United States. More importantly, there are over 7,000 neighborhood weeklies. You know, I get one that's thrown in my driveway every Thursday. You probably get one as well. Or maybe you pick them up at the local store, supermarkets. They're racks when you leave. And then there's specialty print media. There are fewer of them today than there have been in the past, but they are an outlet and they do exist. And we'll spend a minute talking about that. So, how do you generate your own publicity? Here's where the rubber meets the road, and it really is easy. You want to start picking up local media, okay? If you have a daily newspaper in your town, I would tell you, go get it for a week. Go get every day the newspaper, because you want to see who the people are that are writing in there, who the editors are, what sections do they have? Do they have a senior column? Do they have a health column? What is the type of information that they use? And you can find all of these newspapers. If one isn't thrown into your driveway, just start looking around. Libraries, which are currently closed, will reopen, or you can look on the internet. What you want to do, your goal, is to create what's called a media list. That is the editor's name and their contact information. The editor is the person that ultimately you're going to get your news to. This is really the only step that's going to take some time, some effort, some courage, but you're in the insurance business. You're used to making calls to people that you don't know. So this should not be strange to you, and you should not be fearful. Editors do want to hear from helpful people. Now, I'm going to give you some tips at the end about contacting them, but very simply, here's what you want to convey. You want to call the editor. You want to just simply say, listen, I'm a local Medicare insurance. You don't even have to give your name. Hi, I'm Jesse Slome. I'm a local Medicare insurance specialist with some information that can help. In this case, I live in Westlake Village. Westlake Village seniors save time, money, and help them avoid mistakes because Medicare open enrollment is coming, or there are 11,000 people that turn 65 every day. And through my years of working with them, I've found ways to help them save money and save time. I'd like to send you some tips that I think your readers will find of interest. You're not asking for a commitment. I'd just like to send you some of this information that I think your readers will find of interest. What's the best way to get you this information? And you really want multiple options. Here's where you want to probe. You want to say, okay, can I send it to you, a little press thing by mail, or can I email it to you? And in addition, if it's not you, who should I send it to? So basically what you want is that little 30-second speech. I'm a local Medicare insurance specialist. I help for many years seniors in our community save money, save time, and help them avoid mistakes because Medicare can be confusing. I'd like to send you some tips that I think readers will find of interest. What's the best way? Now, a couple of tips on that. So one, you can ask the editor if there's a better day to send it. So for example, a weekly newspaper, let's say our weekly gets delivered on Thursday. Well, that probably means Monday is when they are closing the newspaper and getting it ready to go off to the printer, which they'll send on Tuesday. It'll be printed on Wednesday and delivered on Thursday. So, you want to be a little bit sensitive, especially if it's a weekly paper. And they may say, yeah, don't send it to us on Monday or Tuesday. Those are our busiest days. Get it to us on Thursday or Friday. You want to make a note of that. And then if it's a larger paper, let's say a daily, and you are talking to the local news editor, is there anybody else at the paper who might be interested? That's why I said you want to get the actual paper and look and see if they have, a senior column in there. Is it written locally? Is it national? You're really looking for local people that you can talk to. Now, how do you find those folks? I said, go get your local newspaper, because in almost every paper, there's information on how to contact people. Sometimes it's as simple as a directory like this. Sometimes it's at the conclusion of an article. But as I said, your goal, and this is where you're going to spend time, and the most important part of your time, is gathering a listing of editors' names, phone numbers, and emails, and then discerning when you should be getting them information, how you should be getting them information. You're going to tell them, I'm not going to bother you really. I'm only going to send you when I have something that I think is beneficial for our community and our readers. Thank you so much for talking with me. So, a couple of things now. as I said, the association has a Medicare agent's publicity kit that will contain the tools that you need, but you can do it yourself. You don't need a prepared press release to send. So what would you send? Well, editors and newspapers have standard things that they seek, okay? It's sort of the industry format. And the format are press releases. Press releases are pretty much what you see here, and you can Google and find millions of them online so that you can see what they look like. But basically, what a press release has is your contact information at the top, a title so that you've grabbed their attention, and the title has to be exactly that, attention grabbing. So it's got to be something like, 5 tips to help Westlake Village residents save on Medicare. Medicare open enrollment starts in 2 weeks. What seniors need to know. Things that will immediately tell the editor, 1, this is beneficial information. 2, this is germane to our local readers. The information in the press release must be news-oriented. That means it must be timely, it must be beneficial and relevant. It must be short sentences that really, think of yourself. What would you want to gain out of reading a newspaper story? And the third most important part is it must be non-commercial. And this is the part where the publicist's art really becomes, so important. So you want to see your name and number in the newspaper. The editor wants to provide the information, is willing to quote you, but doesn't want if you want to see your name and your company name and your phone number in the newspaper, they look and say, buy an ad. And you look and you say, I don't want to buy an ad. I want this free publicity. So the publicist's art of making a commercial message sound non-commercial are very subtle things. So for example, let's say one of the press releases is going to talk about, in normal days, we would talk about having a local seminar or get together or offering a free brochure or something like that. How do you get that free brochure? How do you attend the seminar? Well, that's where you look and you say, seating at the seminar is free, but reservations required. Call agency name and agency number to reserve a seat. They're very subtle things. You're not going to be able to say, call Joan Smith, Medicare insurance agent at. You have to find subtle ways, offering something, having an event where a reservation is needed, offering free comparison appointments, let's say to compare prescription drug plans, things like that provide a benefit, and now force the editor to tell the reader how those things can be achieved. So that's a very subtle art in your press releases. What to send? So just story ideas. You want to be prepared throughout the year, not to inundate an editor, but to have 2, 3, 4 things that periodically you're going to send. So, as I said before, one story might be how to prepare for 2020's annual enrollment period, especially because that's timely and so many people have heard about it. Story number 2 might be a little bit longer. Tips for shopping for Medicare supplement. The association does an annual study that talks about rates, lows, highs, compares the difference, how to pick the best plan, how to avoid mistakes, what do you compare, how early do you shop, can you switch, etc. Tips for shopping. I just shared a free comparison offer. Let's just say the prescription drug plans, which obviously get reviewed every year. If you look and you go, well, if you've started to take 2 or more new prescription drugs, we'd offer a free comparison if that's something that you do. That would be beneficial to consumers, etc. Editors, so at weekly newspapers, you could have a series of stories. You might send it out quarterly, once a quarter, etc., to them, so that your name periodically appears. Editors at daily newspapers must be a little bit more newsworthy. So you want to tie in your press releases to key events like the annual enrollment period coming up, how to prepare, final chance, why you don't want to miss out. Those are the types of stories that editors at daily newspapers are looking for. So when to send your material is important because you have to understand newspapers plan in advance, especially when it comes to editorial. They have a very high demand for their editorial space. You're competing with other people and you want to get in there before. You're not, and sometimes you're not the only Medicare agent who's sending out information. So you need to get it in there first, make it good, make it better than the other person's, etc. So at weekly newspapers, if we're talking about the annual enrollment period, you want to really start in late August, early September, about 4 weeks before, 4 to 5, 6 weeks before AEP starts, so that it's there, etc. The editors of the daily newspapers, shorter lead time, 2 weeks really before, if we're talking about the story about preparing, and 2 weeks before the end of doing it. And again, it depends if they're telling you, if the weekly newspaper says to mail it, which I assume today most people are taking things by email or fax. Although I would tell you there's nothing wrong with doing both. For an extra cost of a postage stamp, making your stuff stand out is certainly not going to hurt your efforts. And people often ask, do you need to follow up with the editor? I don't think so. It depends on your relationship with them over time, but you don't want to bother them. You really, you might just send it to them and in your email, just say, hey, I'd appreciate just knowing, I know you get a ton of emails, I'd appreciate just knowing that you got this, this attached story, and I thank you. And for weekly newspapers, the more you can do to stress that you are local, that you are within their community, the more your message will stand out compared to the news that they get from all over the country and from people outside. Being local is an advantage. You are not only their customer, their reader, you are the local specialist that they really want to have a relationship with. A few final tips as we do this, because you can spend hours learning to become a publicity professional, but I promise you, if you start slowly, you'll find that it's actually works. It's worked for many Medicare agents who we work with, and it can work for you. So inevitably, when you're calling into a publication and if you talk to the editor, sometimes the editor and the publisher are the same. And the newspaper only exists by selling ads. They do not exist by running free articles. And you should acknowledge that. So how do you handle it when the editor or the publisher says, well, yeah, that's great. What we want to do is have you run an ad in our newspaper. You do not have to do that. One is not tied to the other. And I would tell you that if that's what they ask for, you can graciously say, listen, I really appreciate that. At this point, I just don't have, dollars budgeted for ads. I'll send you the information. If you find it's of value to readers, great, use it. But I totally understand. And I hope that as my business grows and as this thing, as we work together, I will definitely, consider advertising down the road. And yes, if they run an article or 2 articles for you over time, you definitely should think of trying a small space ad. It does help them out. It solidifies your relationship with them, but you do not have to do it initially. Definitely send a note, a thank you note or an email. When an article appears, it is absolutely good form and really nice to just send them a note and say, hey, I just really so much appreciated you running the article, the piece that I sent you. And note that they may cut things or change it. Either way, especially if they cut what's called your credit, you still send the note acknowledging. Now, people ask me, when the article runs, will your phone ring? Sometimes it will. Sometimes it will generate a lead or two. Sometimes it will generate referral sources. But the bottom line is that publicity is designed to create awareness for you. And over time, it's like anything else, it builds. And most importantly, it gives you a reprint. So you can see on this photograph here, these people took their reprint and they kind of cut it and they framed it. But they started you want to use the reprint, whether it's reprinting it and making copies that you put out, whether it's reprinting it and showing on a website or through social media, showing that you were the one quoted in a local newspaper is worth so much in terms of positioning you against competition. So I talked earlier about the Medicare Insurance Publicity Toolkit that I have prepared for agents. So there are two ways to get it. And this is the Publicity Toolkit that will help you. It will give you the email suggestions. It will give you fill in the blanks articles for AEP and post AEP. I'm in the process of creating it now. And basically it will come to you as a Word document. All you have to do is put it on your computer, see where I have put in, fill in the blanks. It's all prepared for you. Personalize it, and then you're ready to go to get it out to the local media. So there are two ways to obtain the Publicity Toolkit. If you are listed on the association's Find a Local Agent online directory, it's free. If you are not listed, you can purchase the Publicity Toolkit for $199. You just need to call the association. The phone number is there on the screen, 818-597-3205, 818-597-3205. We'll take your credit card information and get it off to you prior to AEP. If you look and you go, well, should I be listed? And what is the association's directory? The American Association for Medicare Supplement Insurance has the only national agent directory that connects consumers who are looking for local Medicare agents, and they are. They don't all want to buy over the phone. They are looking to talk to or to meet with an agent locally. And you go onto the directory, and the consumer does, they type in their zip code, and up comes a listing of agents. A one-year listing is $149. So you could conceivably, if you were just watching this and you were not listed currently, you could list yourself and request the Publicity Toolkit and save yourself $50 and hopefully benefit from the listing. A 3-year listing is $275. And as I say, we go out once a year when the Publicity Toolkit is ready, which it will be. We go out to everybody who's listed and just tell them to send me an email and request it. So to get more information on or to add your listing, go to medicaresup.org/get-listed. And then you can see, you can read testimonials from real agents, etc. Lastly, what I want to do is I'm asking for those of you who are doing your own publicity for Medicare Sup, I'd like you to share your success with me. Let me post your results to encourage others. I truly believe that generating publicity is such a powerful tool that will enable you to stand out from the competition. And today, there are so many competitive agents who are also selling Medicare options. You want to stand out. So when you do that, it will tell me that this is working, that it's working for you. And I would really appreciate if you would send me, a shot of the resulting publicity that you have benefited from. There's my email, jslome@medicaresup.org. So in conclusion, I want to thank you for watching this presentation. I want to just conclude with the following. Publicity is probably the most powerful tool, most powerful free tool, or almost free tool. Well, it is free if you create your own press releases and things, and you can. It is the most powerful free tool that you can use to generate long-term exposure and to make yourself appear as the local expert that people really want to work with, that the local media have designated as their go-to person. If you don't want to create your own publicity tools, you can either buy the kit from us by calling, or if you are listed on the association's Find an Agent directory, which I will tell you is something that we encourage people doing because consumers do use it every day to find local agents, get yourself listed and then request the kit. Go to medicaresup.org/get-listed. Read more. It's easy to add your listing. I appreciate you taking the time to watch this. I hope that you find it beneficial, and I wish you a good day. Thanks.